All right, hi. Next question is from Claire. Good morning, Claire. Okay, and so Claire asks, oh, yeah, by the way, I don't know, did you see this? Yeah, Wardrobe by Nicola, of course, but I'm on an entire coral reef today, I think, yeah. Which I gotta say, I really like, yeah. Go Phylum Nidaria, yeah. Okay, anyway, back to this. Let's see. Claire asks, if I test positive but never have a fever or other symptoms, how do I know when I'm no longer contagious? Yeah, great question. The answer is you don't know. The only way to tell is with a test, and what you want to do is get two tests a week apart that are both negative. And yeah, at that point, you can be fairly confident that you're probably negative. But they're going to have to be either the saliva test or the swab test, where they swab the back of your nose or down your throat. Those are going to be the accurate way to do the test. Um, yeah, fecal tests would work and would be even better, but yeah. Now the problem comes in that I've had reports from several people that they go to their doctors and ask for a test, but if they've already been negative, the doctors are saying we don't have enough tests, or yeah, we don't have enough time, and no, you can't have another test. Yeah, whatever. Come back when you're sick. Which is there may be a reason. Like at that place and that time, that may be the thing to do. And so I'm going to try to defer to the doctor's judgment there. But overall, that is not the way that we get out of this. And you basically have to assume that you may still be infectious after this. And so it's quite the opposite of an antibody passport. You've got to assume you have a COVID passport and it's stamped that you are basically dangerous, yeah, for the indefinite future. There have been cases where people have held on to this virus for months. And if you have the virus inside you, you can definitely spread the virus to people around you. And so, yeah, the antibody test would not do you any good in this case. It would just confirm that you'd been infected at some point in the past. Yeah. And it wouldn't matter whether you had the ELISA test or any of the other tests. Yeah. Because they're measuring the wrong thing. They're not telling you what's going on now. They're telling you what happened, back then. And yeah, you would probably know by that point exactly what happened. So there you go. That's the correct way to do it, and that is also the reality of it. If you happen to be in a place that doesn't have that many cases, and or you can find a doctor or provider that is willing to just do the test instead of arguing with you about the test, then yeah, come in and try and get tested, or go to two different test sites. Drive around and get tested that way. They may make you pay for the test, but that's how you get the peace of mind and actually know that you are probably no longer infectious. Yeah, about normally it would be about 2 weeks after the symptoms go away, but it can be longer. But no, negative test is definitely the way to go. So yeah, thank you very much for a good question and a very frustrating question, I am sure, for a lot of people. Thanks very much. This is Ask Dr. Ben.